ask a lot about Nimue and microneedling. In Nimue, we do have a microneedling roller, and we even have some in the warehouse still. But we don't really promote it that much anymore, and we don't do microneedling trainings with Nimue microneedling roller anymore, because I know that a lot of you just have your own devices. But it doesn't mean that you can't use Nimue products with them. So Eunice is gonna take you through the journey of all the Nimue products that you can use in your microneedling treatment. So over to you, Eunice.
Thank you so much, Lydia, and ladies, for joining your late afternoon and my nice early morning as always. But yes, needling. You know, I remember distinctly when I started in this beauty industry, which is 30 years ago now. I remember that there was not devices and things like this. We didn't really talk about it or use it. And if it was used, in those days it was used by doctors. And I remember when that one, what is his name, what is his name from Environ? He started needling in South Africa and worldwide. There's Fernandez. So Dr. Jeff Fernandez started this. And I remember I used to be then principal of a college, and we still thought, oh my goodness, this is not going to last. I mean, look at this therapy. This is really a bit crazy. And I must tell you that in my personal beauty life and in my professional beauty life, that needling is one of the best treatments you could offer your client in a cabin. And yes, Nimue has unfortunately not jumped onto the pen and the derma stamp and those kind of things for various reasons, because every company will have their own reason why they stick to a certain device. But it really works. And the beauty of our product is that no matter what device you are going to decide to use, you can use Nimue. But today, you know, we can't actually talk about rolling or needling and Nimue even if we don't just talk a bit about why we roll. Why do you use the pen? Why do you use the derma stamp? Why do you use the electrical device combined with the stamp nowadays or the pen? And why do we use a roller? What is the benefit of that? And it's collagen. We all want to help our client to have a younger looking skin. And this really works. So let's just have a quick look again at collagen and why it's so important to see collagen as your main constituent together with our ingredients that we use in Nimue, with whichever device you are going to decide to use. Now, we know that collagen is a protein, and it's the most abundant protein in our bodies. And it's found everywhere. It's a protein that we cannot be without. It's in your bones, in your muscles, your skin, your tendons. It's absolutely everywhere. And I love it to see it as a scaffolding. You know, when they build a house or a big building, and I've got that strong scaffolding where those builders climb on to build. That is what our collagen is like. It's a strong, beautiful, rigid scaffolding for the health and the anti-aging benefits of our skin. But then we can't talk about collagen and the effect eventually of the pen and collagen or the roller if we don't talk about fibroblasts. Because fibroblasts to me are also, again, one of the most important considerations that we have to take in consideration when we do treatments or rolling. Now, a fibroblast, that is that principal active cell of connective tissue. And their structure is gorgeous. They are flat, large, elongated cells. They're beautiful under a microscope, and they extend from all ends of the cell body. They're just really gorgeous, and they really work so effectively to keep that structural integrity of the connective tissue. Now, again, our fibroblasts obviously will then be dispersed in connective tissue also throughout the body. Now, they secrete a non-rigid extracellular matrix that is rich in type 1 and type 3 collagen. And that's why it's so important to see these together and to really understand them together. So when we do needling, when you decide to do needling for a client, it's usually preventative aging, delaying aging, or correcting the skin that has gone through maybe pock marks or anything like that after acne, or even pigmentation, but especially aging. So our biggest fear, our biggest monster, our biggest, enemy for collagen is free radicals. And we currently, all of us, suffer from death by free radicals. So when I have a beautiful normal cell, as you can see on this visual, my free radicals will attack that cell, and you can see what the cell looks like in the end. It has a lot of oxidative stress. It does not function properly anymore. In collagen, we have degradation and destroying of the collagen in our skin. And they are unstable molecules. So the free radicals that attack my client's skin are very unstable, and that is why they damage our bodies and our skins and our collagen. So basically they form when atoms or molecules gain or lose an electron. And that is often a result of normal metabolic processes, but also due to factors like glycation and factors like ROS. Now, what we do then with Nimue is we give you a good product to use with your needling so that we can have an antioxidative effect on that cell to slow down the damage that's caused. And then, of course, you know our other products where we actually then also can stop the damage from being caused. Now, my favorite reference to the destruction of collagen and to have the influence on my fibroblast is, of course, UV. UVA, UVB, infrared, HEV, even pollution. So ROS is a main factor that causes, due to the direct effect of UV, a breakdown in collagen and fibroblasts. And we know that also leads to a breakdown in elastin fibers. Every client in Australia, in South Africa, is exposed to the sun. We have beautiful summers. We don't have extreme winters, really, only maybe some areas. So Australia, New Zealand, South Africa, Africa. So we are really seeing a lot more clients that suffer from ROS-induced collagen and elastin degradation. Now, when my client is exposed to the environment, I see her on the plinth, on the bed, and I see there's a lot of damage on the skin due to environmental factors, due to ROS. My first idea, having Nimue, is to fix the DNA breakdown, fix the protein and the lipid breakdown, because that is what ROS targets. ROS breaks down the DNA of my cell, the proteins of my cell, and the lipids. And what is collagen? A protein. So I want to fix it. And with my idea of Nimue, I will always, on this type of client, if she qualifies, I will do needling combined with a peel and alternate it throughout the month and a course of treatments for ultimate skin rejuvenation and collagen and elastin and strengthening. So looking at what destroys our collagen, we now know it's ROS, it's glycation, it's natural aging that we all go through, unfortunately, or fortunately, because it means we can live long. And we have this fragmented, disorganized, less soluble collagen fiber. Now, in a young skin, of course, we've got plump collagen, we've got really good elastin, and as our skin starts to age, and that varies, ladies, you know that you could have a client of 35 that shows more signs of aging than a client of 55. So this all varies and it all differs. And looking at this client, we can then determine what to do. So we want collagen to be formed and to be strengthened through our treatment of needling and the ingredients in our superfluids and the ingredients in our transdermal solutions. So what happens is our fibroblast forms collagen. Now the fibroblast cells produce something called procollagen, which is a precursor for collagen. With the procollagen combined with vitamin C, it forms that collagen triple helix. So here already knowing that how the collagen forms, I already have an idea it could be really beneficial to also add my vitamin C superfluid. We then have the fibril formation, which becomes cross-linked, and then that glue starts to form so that we have a nice, strong macrofibril, which then organizes all those fibrils into that beautiful collagen structure. Now, we have different types of collagen. We have to think of microneedling and ingredients we use. We have to always consider then the type of collagen in our skin and how we want to affect it through the needling process. Now, type 1 is the most dominant collagen, and it's very much more prominent when we are young, so in babies, young kids, which then consists of 80 to 85% of your dermal matrix. So the function of type 1 is the production or the provision of strength for my dermis. Unfortunately, this is also the one that reduces in a photo-aged skin. Type 3 is the second most abundant collagen in our skin, and that is 10 to 15% of your dermal matrix. It's much smaller in diameter if you have to measure the collagen helix, but a bit more pliable in the skin, or gives more pliability to my skin. But it's called fetal collagen, and it's predominant in embryonic life and around blood vessels, and it's just beneath my epidermis. Another collagen that we have to consider when we do our treatments and our needling is type 4 and type 7. Now, type 4 looks like that beautiful visual. It looks like a cross-linked little net that's formed. And that is the main component, again, in my dermal-epidermal junction. So already you can start to think of where a product, an ingredient needs to work together with your rolling system to stimulate different areas of collagen. And this one plays a role with cell adhesion and growth, differentiation of my cells, and migration between the cells. And then type 7 functions as an anchor. So this is the anchoring fibril between my dermis and epidermal layer. This decreases in collagen, leads to that wrinkles that I'll see on my clients, that fragile, older looking skin, and a photo-aged look on the skin. So we have to consider these 4 types of collagen when we manufacture products, look at ingredients and treatments. Now, Lumican is another important aspect that will be affected when we do needling, when we do these type of treatments on our clients, and that's a proteoglycan. So what that does, it's in our dermis, it anchors that collagen together. Now, the Lumican creates that rope-like effect that can unravel, or that we want to keep nicely bound together. And it also becomes less as we age. Now, here, we can focus on certain peptides again that have an effect on Lumican and that help to organize my fibrils in my skin. And that's why I said to you, I love to, on really damaged, photo-aged skin, I love to do a course of, say, the Smart Resurfacer and a needling, but in good sectional divisions in between. When you think of what you want to achieve with your needling, whether it's the pen or the roller or the device, the stamping device, we want to create that process of making more collagen. Now, that term is new collagenesis. New means we want to create a new one, a modified collagen. We want the collagen, obviously, as our protein in the connective tissue. We want to stimulate through our needling. And we want, with the synthesis, is when you make something. So we want to create new collagenesis. What is this? This process is started when we introduce an injury to the skin. So when we introduce needling in any form to the skin, we create a controlled injury. And new collagenesis is started right there. So it's in your hands with the device that you use. You can also, obviously through puncturing with the needles, but also heat can stimulate new collagenesis. Now what happens here is my dormant fibroblasts are stimulated. And when I stimulate those fibroblasts, I increase collagen production in my skin. How long will this take? It takes between 4 and 10 weeks to grow when I do it with needling. So if I do my needling treatment, by 4 weeks to only 10 weeks later, depending on my client, depending on the damage the client has suffered on the skin, depending on her type of skin, it takes that long to grow. The skin improvement is only really evident 3 to 4 weeks after your microneedling session. Now, I always see an immediate improvement after needling because my skin immediately has a plump look. It immediately looks hydrated. It immediately looks better. But after 3 weeks, if you look under the yarners or under any one of the devices, you will see a distinct improvement already in the skin. And collagen maturization needs time. It's like exercise. It's like going on a diet. It needs time. The damage was done. It needs time to transform into a more tensile collagen. And that is what we create with our needling treatment. But then there's another aspect to this, new vascularization. So this is the formation of new blood vessels, new meaning new, and vascular, our blood vessels. So how does this affect our treatment? Vasculogenesis is the formation of blood vessels by my endothelial cells. Now, these endothelial cells, they are recruited from bone marrow, and they actually become that beautiful new blood vessel, but you have different types, and it's also stimulated when I do needling on my client's skin. You also have angiogenesis. So vasculogenesis is when my endothelial cells help my skin to form a single blood vessel. Angiogenesis is the formation of new blood vessels from a consisting vessel, an existing vessel. So I've created new blood vessels naturally within my skin due to all these processes stimulated by needling, and now maybe through angiogenesis there will be like sprouting of my blood vessel formation, giving me even more functional vessels in my skin. The result of the vasculogenesis and angiogenesis is that we actually now can create more energy, more oxygen, and more nutrients in the skin. And this process helps with the toxin removal when I do my treatments. There are other ways to also stimulate my collagen together with my needling, hyaluronic acid. Ladies, you know we have launched a really amazing hyaluronic acid superfluid this year with Nimue. So ideal for that to be introduced in my needling in the skin because it also boosts collagen production. So if I add it in a treatment and I add it in a food or in a supplement, it will also assist my skin even further if she comes for needling treatments. A second element to think of is vitamin C. Vitamin C is not only an element that you have to take orally daily. I totally believe in that. It really is good for your body, and you don't take enough in through diet necessarily, but it also boosts collagen production. So if I use my vitamin C superfluid in my needling treatment, even combining it with alternating it with hyaluronic acid, I can also assist in collagen production even more in the skin. So if my client supplements it through maybe her diet or through possibly taking in a vitamin of a good quality, and then of course having it in my skin as a superior antioxidant, with my needling it even benefits the skin more. And then retinol. Retinol is one of my favorite elements. Retinol is not only a superior anti-aging ingredient, but it also is a type of an antioxidant. So it will also boost the collagen levels in my skin and increase that lifespan of the collagen. But it also blocks that enzyme, collagenase, from destroying collagen. So already, before we even look at Nimue's needling, we have 3 products that already stand out if my needling focus is going to be anti-aging and collagen production that you could use into your device. So looking at microneedling now, I told you from the beginning, it's one of my favorite treatments because I have seen results. Skin needling is rejuvenation. Skin needling is creating collagen, stimulating collagen production. So what do we do when we needle or when we roll, when we pen? Whichever device you use is you puncture with a really good piece of equipment lovely cylindrical, nice punctures in the skin in a very good formation. It depends on the length, of course, of the needle that you're going to use to whichever result you're going to stimulate, and the width of the needle. And in the industry, it can vary from 0.2 to 5. Now, with Nimue, you know, we only, and in skin and therapists use 1 ml, but I've seen treatments at doctors and so on with 3 ml, and of course the 0.5 that some people sell online for you to use, to buy it, use at home, which you shouldn't, but in any case. So what I want to create with needling, apart from collagen induction, the primary effect is to create a natural wound to stimulate the processes in my skin. A secondary effect of needling is that microchannels that help with the penetration of my actives. So whether you're going to do a treatment without any product, or whether you're going to do a treatment with product, you will still, to a certain degree, stimulate the collagen production, induce collagen production. And the beauty of needling is that there is minimal downtime, but there's definitely a guaranteed result. So whether you decide to use our roller, whether you are very much into the pen, into the stamp, and I don't know who of you have seen the device. I've gone for a training just to see what they have to offer, where they use a pen that actually has an electrical current attached to the device, that while you have your pen treatment, you have a high energy, more like a high frequency current that also passes through the skin. Some people love it, some people don't, but depending on what you want or have in your business, you can use any one of our superfluids. Now, thinking of what I've just said about Nimue and about ingredients that stimulate collagen production, we have the retinol superfluid. Perfect for lines and wrinkles, perfect for anti-aging. We have our vitamin C, which is so needed in the skin and for collagen production, where we can assist the skin even further. Ideal also if my client has pigmentation. It could be mild pigmentation, it could be severe pigmentation on the skin. Whether I'm going to do the needling on pigmented skin will depend on the level of pigmentation and how deep the pigmentation, of course, is. But I have my vitamin C for collagen induction and for a client that wants that lovely glow. I then will go straight into my hyaluronic acid. If I think of collagen regulation, collagen induction, I think of Nimue, I think of my older client or my client that maybe starts to show signs of aging, I can immediately think of hyaluronic acid. Wonderful acid to stimulate that production through those microchannels. But then we still have 3 other superfluids, and they can also be used in this treatment. You can use the CA. I love to add my CA if my client has a bit of a sensitivity, if there's already a bit of a redness, or I know that she stimulates easily, and I want that beautiful effect of that anti-ROS effect on the skin, that calming, that healing effect. NAD, as you know, is not only one of the best products to take in orally, but through our product, we can now stimulate NAD formation in our skin. And of course, why not with our roller or our pen, help that to also penetrate better. And if I have a client with an oilier skin that needs a prebiotic, that needs that food for my good bacteria, that needs that antibacterial effect for my mild acne or even my severe acne in my treatments, of course, we've got the PB. So you have the choice to look at 6 amazing superfluids with really superior quality and percentage of the active to put on the skin for whichever need your client has. So ideally, you will look at retinol, vitamin C, HA for anti-aging, for collagen induction, and the others for my secondary effects. And then we also have our transdermal solutions. The immediate effect, my favorite transdermal solution to roll or use the pen on is my interactive TDS actually. The interactive TDS has a calming effect on the skin. It soothes the skin while it builds my biolipid layer, but it also has a lipopeptide that has an anti-aging effect. And then secondary, the second one I love to use is, of course, my TDS for environmental damaged skin. And then I will use the other two depending then on my secondary or my condition of the skin or the skin type. How the Nimue roller works and why we still have the roller is that every brand, every person feels differently about it. We believe that there's more control with a roller. It's more tricky though, you really have to train your therapist very well. But a roller, the one that we manufacture, has 192 sterile fine stainless steel needles. They are perfectly spaced to create the biggest area of penetration, the biggest area of creating your microchannels, and those channels that will then, of course, with my active, improve the result that I have with Nimue. The surrounding tissue remains healthy and our epidermis remain intact. So we don't have a long needle, got the 1 mil needle, because that's the maximum we believe should be penetrated into the skin. It's 1 mil, the diameter is 0.2, and it's tapered to a 0.07 tapered end or tip at the bottom. Having the 192 needles in rolls or gives us the opportunity to have a larger surface area to roll over, which then makes that area more effective for the penetration of the active into the skin. There are many advantages of using a device, whether it's a roller or a pen. It is really minimally invasive. It stimulates my collagen induction and there's immediate results, and you now know that there will be amazing results 4 to 6 weeks later, depending on the damage. Pain could be minimal to moderate. Some people experience it very differently. And of course, if you think of a roller, it's very inexpensive. Some pens become a little more expensive, but it's up to you in your business or what you want to do for your client and what you want to cause. We do not believe in causing bruises or extensive bleeding. Adjust your pressure always according to the client's skin and what I want to do. Now, it's nothing new. Rollers or pens or devices have come from 1905. That was when it was basically introduced in the skin industry for various other reasons. It was actually then used like a resurfacing to remove all skin, all top layers of skin, where they rolled over, but where this device had an abrasion, like what do you call it, paper, scouring paper, that would actually take off the top layer of the skin, especially post-war and when clients had lots of damage to the skin. Now, through the years, thank goodness, when we introduced our roller in 2008, it's changed to being really very effective treatments on the skin. Now, with the different devices that we know our products work really well is the roller, the rotating wheel, the dermis stamp have been proven to work really effectively with our products as well. I don't know who of you use the stamp, but it's a small device. Small areas could be targeted if you only want to target an area, and it also creates your micro injuries. And then you've got your pen and different other types of electronic needling devices. So you've got an automatic derma pen with your disposable needles. In this case, you often can work in many directions and the needle length can be adjusted during your treatment. Now, if I look at the different lengths of needles, what we have noticed or seen is that the length of the penetration, your 0.25, is in your stratum corneum only. It's very superficial. It's really not intense. It's really not painful at all. I find that I could, when I practice with those, can do it on myself, even a 0.5 effectively. Your 0.5 will penetrate a little deeper in my epidermis, and our 1 mil roller, 1 mil needle will penetrate into the lowest layers of my epidermis. The longer the needle, the deeper the penetration. So from 1.5 to 3, we obviously now have penetrated the dermis, and it's not an area that Nimue focus on in training. Every different needle length will have a different benefit and a different drawback on the skin. So if I look at the 0.25, this one is mainly used in our industry to boost absorption of my topical ingredients. It does not treat fine lines. It does not stimulate collagen growth. There's no bleeding, and it honestly is not painful at all. My 0.5 is also mainly used for the absorption of topical ingredients, but it can already start to treat superficial scarring. It only, however, triggers a mild collagen growth factor, minimal bleeding. You could possibly have a bit maybe on the forehead, or you press a bit hard, and it could start to be slightly painful or uncomfortable for the client. Your 1 ml that we work with boosts absorption of topical agents, topical ingredients. It can have a benefit on superficial scars, on medium depth lines and wrinkles. And the 1 ml has been proven to reduce sun damage and even mild hyperpigmentation. The drawback, there's redness after the treatment. It's tight after the treatment, even for a day or two. And in some cases, there's even a little bit of flaking that occurs. Bleeding, slight, could have a bit more moderate bleeding on areas where it's bony, if you maybe pressed a bit hard to. And then, of course, the pain level here can be minimal to moderate. So for some people, it's really painful. And for others, they say, no, that's fine, you can carry on. So it depends on the client. The deeper, the longer the needle length, the deeper the penetration, the deeper the treatment result will be. So the doctors that use 1.5 to 3 ml, they can treat severe scarring and stretch marks. A deep penetration could actually cause some side effects, depending on the device and what product was used in this instance, and can lead to redness, dryness, and flaking. There's significant bleeding, and it's very painful. Now, those of you that know me know that my daughter had a baby nearly a year ago, and she has had severe stretch marks on the lower abdomen. So immediately went to one of the laser clinics that specialize in needling, and had a 2 ml and varied with a 3 ml rolling on the stretch marks. And yes, they won't ever be completely gone, but they look 100 times better. So depending on what the problem is that you treat will depend on where you go and what you do for a client. We need to create a wound. So when we create a wound with our rollers, with our pens, with our product, there's a stage 1, a phase 1 of wound healing, where we have a natural response to trauma. So you will see this immediately, where if there's a little bit of bleeding, where a little blood clot will form on the skin. The second phase in this healing of my skin, in the wound healing, is an inflammatory phase, and that's where we see that redness, where the skin is red all over, or more so in certain parts. So here we are now having mast cells that's released, that causes this release of histamine that causes this effect on my skin. Phase 3 is where my epidermal growth now starts, where the remaining cells divide and produce new cells. I've started in this healing, in this new anti-aging phase, and finally in phase 4, where I have a complete healing and a remodeling phase within the skin. So just in summary, it's going to take your client's skin 4 to 6 weeks to have new growth of collagen synthesis. The improvement will only be visible on scanners and on certain lamps and on our Jana systems 3 to 4 weeks later, and become more visible for the client. And the maturization, especially to transform it into tensile collagen, is that time that it will need. Our needling, we want these wonderful fibers in the natural microchannels that we create to stimulate, to take up those wonderful ingredients, and to really play a good role in that blood vessel growth, as well as in collagen stimulation and collagen improvement. Now, during this needling, when we have our growth factors that are released within the skin, that act natural growth factors, fibroblasts, they also then further stimulate the growth of collagen and the production of collagen. This is just the interesting slide if you were interested in which growth factors are stimulated. For those of you that love ingredients and love science, our TGF-B, our FGF7, and our EGF, so epidermal fibroblasts, and of course factor beta 3. These are all stimulated through our cells, our fibroblasts, and our platelets and keratinocytes when you do a microneedling treatment on your client. Benefit when you do any form of needling is that there is an immediate penetration and immediate advanced penetration of superfluids and transdermal solutions. There is a lightening of pigmentation. Due to all the processes that you now have seen that takes place within my skin, I can control the melanogenesis process better, strengthen the living cells, normalize keratinocytes, stimulate the Langerhans cells, and activate my dormant melanocyte. Cell turnover, which is quite important when you work on different clients in different ages to consider when you do needling, that we know that in our 20s, our skin turnover is really amazing. It works fast. It's 14 to 25 days. And as we age, you can basically relate the days to the age group. So that's why in our 50s, 40s, it takes so much longer, even double the amount of time in your 50s for cell turnover. So if I use my needling device then on my older client, I can stimulate the cell turnover. I can speed up cell turnover and help that whole process of keratinization in the skin. So not only will I have collagen synthesis, I will have wound healing, I will have elastin synthesis, I will increase the production of gags and have neuro or neovascularization within the skin. Any clients that's on my plinth that I'm looking at what to advise, if there's a loss of plumpness, if there's a loss of volume, if there is a reduction in pore size needed, an improvement needed in the texture, if I need a softening of the lines and wrinkles, that is my client for this treatment. It will definitely help to enlarge my pores with my superfluids and my TDS. It's going to soften the pores. It's going to thicken the skin on the surface. I'm going to be able, on my scars on the skin, I'll be able to treat rolling scars and box scars very effectively. However, ladies, on ice pick scars, it's less effective. For my ice pick scar, I will need possibly to go to a doctor for my 3 mil needle treatment, but really effective our needling are 1 mil on your rolling and your box scar. Microneedle and acne. Of course, you can use this on your milder acne. You won't perform rolling on acne grades 3 and 4, but on your mild acne, on your client that suffers from unstable sebaceous glands or sebaceous secretion, of course you can do it on them. It will reduce that hyperproliferation of your keratinocytes. Now, acne bacteria, anaerobic acne, therefore needs needling to open up the pustule. Now, that pustule contains pus, which you know is made up of white blood cells. So the bacteria will therefore die and not spread with microneedling. And it will improve that barrier function, and our needling together with the correct TDS or the correct superfluid will also help to heal and to help with that sebaceous secretion and have an antibacterial effect on the skin. This is just a slide for you to tell you about the various types of your bacteria. So if we think of our Staphylococcus or staph group of bacteria, this one can cause a multitude of diseases on my skin. This is the one that causes boils and impetigo and even food poisoning, toxic shock syndrome. So my propibionic acnes, that is the bacteria that grows inside my pores. And they feed on the sebum that's produced by your sebaceous gland. Now, the Staphylococcus, that one spreads through close skin contact. That one spreads when you share toothbrushes and towels and face cloths and compresses. And even, which is very interesting, it's been proven to actually then also obviously through coughing and sneezing can spread. Where my Propionibacterium does not spread from one person to another person. The appearance of the Staphylococcus that we do not work on is your boils and your abscesses. That area is tender, it's very painful. Where the acne that we can work on is inflamed red skin. That's usually the appearance that you see immediately. You cannot and should never perform any form of microneedling on Staphylococcus bacteria. However, depending on the grade of acne, if it's a Propionibacteria, you can perform microneedling on that skin. Should a client come for microneedling treatments with you, please ensure that they provide adequate sun protection. Usually, if a client does not use the sunblock, this is a big consideration for me to really guide her to take care of the skin that way. If she's had previous facial radiation, I would possibly not do the treatment for at least 3 to 6 months, depending on the level of radiation. Accutanes in the last 6 months, please don't do any rolling on that skin. Cortisone, I will wait for my client to have stopped the use for about 8 weeks or 2 months. And we know with fillers and Botox, you need to wait about 4 weeks for it to settle and for the therapist not to have an effect or moving about of these treatments. And clients with unrealistic expectations. We all want to look younger and better, but we're not going to take your wrinkles away completely, but we can brighten the skin. We can have an effect to soften those wrinkles and to have an effect on the acne and the pigmentation. A question that always comes up is, can I advise in a Nimue treatment the use of a numbing agent? Now, as a cosmeceutical brand, we are not allowed to advise anybody to use a numbing agent. We can't sell a numbing agent because we're not medical. So what I want to do with this is just tell you the effects the numbing agents will have on the client's skin. It's of course not advised with Nimue treatment. The lidocaine or prilocaine, they actually block your nerve signals in the skin. That's why you don't feel any pain. It's not painful at all. Now, allergies to lidocaine can result in medical attention that's needed urgently. You can actually go into a shock, and the overdose can lead to heartbeat, increased heartbeat, uneven heartbeat, seizures, coma, and respiratory failure. It sounds extreme, but this is really all the precautions that you will see if you purchase lidocaine. Your EMLA, which is a bit milder, it works very similar to lidocaine, and you usually, it's more safe should you decide to use it because it contains smaller amounts of lidocaine. On myself personally, I find needling quite painful. So if I will purchase my own EMLA and take it to the salon and use it, but it's really not recommended. We want that stimulation, and the 1 ml can be tolerated if done correctly. So if you do a treatment, eliminate contraindications, get the client ready. Remember to wear your gloves when you do a treatment on the client. Remember to select the correct product for the correct problem, which obviously also always relates to having done a really good, effective consultation on your client. Make sure that every area is disinfected properly, that your device is disinfected. And nowadays with the concern with COVID, etc., we know that there are even more stringent rules in when we do or practice hygiene in our businesses. Now, the microneedling treatment is the only treatment in Nimue where we say do not use an SPF straight after treatment, but definitely start to use it the very next day. But the reason we say don't do it is because sometimes if those microchannels have not closed up, the after the day creams and the SPFs can actually block those channels and create a bit of a white head within a day or two. But the next day they can do it because after a few hours, the microchannels have closed up. So even if my client is going to maybe have the treatment early morning, this afternoon she'll go out. If at least 3 to 4 hours she's waited, she can start to apply it again. The skin might feel a little fragile after the treatment, so possibly that night she won't want to use her active, obviously she's not going to use the active lotional gel, but she maybe would not want to use her conditioner even. So I always recommend after needling treatment, a gentle wash that evening and just put your pre and post on and put your night product on. What your client can expect is within 24 hours, there could be some redness. Some people have a bit of swelling, some have more, and some people have a little breakout of petechia or those little purple spots. And some people even have spots of bleeding. Within 1 to 2 days, your client could experience a mild redness still. There could still be petechia present. There will be a reduction in swelling if they tend to swell. Could even have a bit of minor itching where they want to scratch the skin and a tight sensation. By day 3, there's maybe still a little bit of dryness left on the skin, just feels tighter. And by day 4, 5, you're absolutely fully recovered. Most clients will even from day 1 say, no, I'm fully recovered already. Please apply all your correct home care for the client. Do not utilize your active gel lotion, even your conditioner the same night. Do not expose to sun. Please stay out of sun that day, the rest of the day, and always wear sunblock after that. And if your client is maybe going back to work, you can only apply your foundation also 3 to 4 hours after a needling treatment. Now, what's lovely to use for home care is to maybe now at this point, if she's not on the pre and post already, to upsell her on the pre and post serum. This is a wonderful serum, as you know, to now build the bilipids, to keep the bilipids intact, and to provide an extra protection on the skin. And please, ladies, always, you know, when we do analysis, we do mind, body, we look at everything. If you know they are not having a healthy diet, maybe recommend that they supplement effectively. So how many treatments with a roller? We recommend 6 treatments up to 1 month apart. Now, those of you that have been with Nimue for a long time, you're sitting there thinking, Eunice, you know what, years ago, you came for training and you said we do it every 2nd week and then every month after that. Now, due to lots of research that we keep on doing and that comes to the fore, there's been evidence that if you do your treatment 1 month apart, because we now totally understand how long it takes for the reepithelialization, for your new vasculogenesis, and for all those processes to take place, monthly intervals are best. So space them 1 month apart, depending on the phototype, of course, and depending on the type of pigmentation, should you work on pigmentation. And a course of treatments of 6 is enough per year. And they can now and again, when they feel the urge or when you want them to maybe just have a bit of a once off again as a recap on the skin. Now remember to explain to your client that they could have discomfort, explain what they could feel. Very important to also say there might be discrete little cracks on the skin, depending what device you used, but that it will actually disappear by the next day. We do not believe in over-aggressive needling. We do not believe that you should use that roller for longer than 6 treatments. The needles start to not be as effective. They go blunt eventually. And please keep the roller for only 6 treatments when you work with a Nimue roller. What am I going to look at? My client's concern, my client's experience with the treatment, her immediate response, and explain to her the short and the long-term benefits. That is what I'm going to look at for that client when I decide to do needling. And I'm going to explain to her it's a slow, gradual approach, and explain to her how the collagen structures will improve over time. Now, with needling, there's often questions people ask. And the one is, can I roll over a man's beard? No, you can't really. You shouldn't really. And the reason is that I cannot see what goes on under the beard. I cannot see the skin and the reaction, and it will lose the efficacy to roll over a big thick beard on a client, on a gentleman. So what indications are ideal for this treatment? We want to first of all look at my client where I want to work on the collagen synthesis, elastin, aging, lines and wrinkles, and then we've got our secondary aspects to look at. How many courses? 1 course a year is enough. And then I could do maybe just a recap treatment later on. Can keloid scarring be treated? Now this is a difficult one because if you have to consider the length of needle to treat deeper and more superficial scars, you can imagine you have to understand how old the scar was, how deep the scar was, what caused the scar, and where on the area the scar is. Now with keloids, we don't guarantee that we're going to take it away. I believe you need a deeper, a longer needle, but I have seen tremendous results on keloids. But the sooner the client comes to me, the better I can treat her. If a client tends to form keloids, I'm very careful to start rolling. Then I will really look into her history of skin. I'll really look at what stimulates keloid formation on her skin before I decide to treat her. Why can't I use SPF? I've explained to you because of the microchannels and because our product could possibly, your SPF could cause a bit of a whitehead formation. And my Pro Age foundation, I will also wait 3 to 4 hours before I apply it. We know now how microneedling works, and I'm sure that you'll be able to explain it to your clients and the reason why we say 6 treatments and how often it can be done. We also now, after this session, know the benefits of microneedling. Now, that is all of my PowerPoint today. I want to, however, tell you about various things that you could do for a client if you want to think of combining your Nimue peels and your needling treatments. Now, I've just said to you, needling is done once a month. And my ideal client for needling always, if I'm not looking at scarring or pigmentation, if I'm looking traditionally, it's aging. It's delaying, prevention, and fixing. That client will do very, very well with, say, my Smart Resurfacer peel or my SRCED skin, that peel. So how am I going to combine it if I'm only allowed with a Smart Resurfacer to do 1 treatment a month and with my needling do 1 treatment a month? I will then work out a course of treatments for my client for argument's sake. Say every 1st of the month, she will have her needling treatment. And every 15th, mid-month, she will have her peel. That means by the 1st of the next month, it's been a month for needling. She can have 2 weeks later a needling treatment after the peel, which then by the 15th of the next month means it's been a month since the last peel. So I can do that. I can have 2 weeks apart, but with my different treatment protocols, my different focuses. If you should want to develop a course of treatments that's really going to be superior in result for my client that suffers from lines and wrinkles. Pre-COVID, we obviously were at the office more, and about 1.5 years ago, I did this with my SRCED and needling on a staff member that had, through lots of trauma, lots of premature aging on the cheek area, but really lots of lines, horizontal, vertical lines on this area. And that's exactly what I did. I did this SRCED and the microneedling 2 weeks apart, but meaning each one was only once a month. The result after 6 months was phenomenal. The only area that really was still tough to see a wow result was the lines around the lips, which was really very deep. And obviously she had deep, deep crow's feet that had a lightening effect, but obviously won't go away. So really effective way to treat my clients if I want to do courses, or alternatively, she comes for a course of my microneedling treatments with retinol for 6 months and then start on the peeling again. But the benefit of doing your peels and your microneedling is just absolutely invaluable for the client that suffers from aging. So that is my chat for today. Lydia, back to you.